Somalia is now enjoying the longest period of relative peace and security since the fall of a central government in 1991. This has led to the country registering tremendous improvements in various sectors. This has also led to Somalis from the diaspora having confidence to return back home and help in reconstruction. This development has been made possible partly due to the support provided by the African Union Mission in Somalia, AMISOM, in stabilizing the country by driving out the terrorist group Shabaab from population centers in south-central Somalia and denying them freedom of movement. AMISOM is also in joint operations with the country's security forces, implementing a national security plan following decades of civil unrest and conflict posed by violent extremism stemming from the armed group Shabaab. In February 2020, as Army and police officers, Army chiefs from AMISOM troop contributing countries, or TCCs, and Somali security forces met to discuss future operations and an upcoming drawdown of troops under the Somali Transitional Plan. A deadly virus spreading across the globe was threatening to derail significant advancements that have improved the nation's standing on the world stage.
General operation. I submit, sir.
By March 2020, the World Health Organization, WHO, declared a global health emergency after reported cases of a highly contagious respiratory disease was causing mass fatalities. The virus would later come to be known as the coronavirus or COVID-19. The escalation of COVID-19's contagion across Africa would affect how AMISOM would undertake its operations given activities requiring close-quarter congregation.
On the right of the document.
How would peacekeepers, on the scale in the area of operations across Somalia, continue to discharge these mandates without putting the lives of its personnel and that of the Somali community at exposure?
In spite of COVID-19, we had to step up and put forward our best foot to be able to deliver on our mandate. So everyone had to put their hand on the deck to make sure they went the extra mile to do what was needed and made our deliverables achievable. For the first time, we also had our mission implementation plan meeting virtually, so nothing was restricting us. What we thought was impossible became an easy walkover.
COVID is new. We've all been in crisis situations, but nothing in the magnitude of COVID. And nobody could have predicted and nobody could have planned for it. So a lot of the mission work that was done in terms of the COVID task force in that crisis was one of the things I'm really proud of.
The COVID-19 pandemic across Africa, which began in March 2020, has not significantly affected how the African Union Mission to Somalia, AMISOM, military component, undertakes its operations. Through the multifaceted mandates of AMISOM include undertaking activities requiring physical contact with all stakeholders, which posed a seemingly insurmountable challenge at the time. The implementation and observation of African Union Commission The Africa Centers for Disease Control and Prevention, World Health Organization, and Federal Government of Somalia COVID-19 instructions, directives, and guidelines in the mission area come in hand and stem the spread of the disease.
One of the first actions AMISOM took to mitigate the spread of the pandemic in the mission was to establish a multidimensional COVID-19 committee comprising various committees within the military, police, and civilian components to guide the mission on how to deal with the pandemic.
AMISOM and the United Nations leadership established a joint task force on the pandemic to coordinate all COVID-19 activities, including regular situation analysis and the provision of recommendations on COVID-19. Various public health information, education and communication materials, including pamphlets, banners, posters, flyers, door stickers, and roll-ups, were printed in the languages of AMISOM troops and police contributing states and distributed across all AMISOM sectors.
As the pandemic gathered pace, AMISOM, the federal government of Somalia FGS, enforced lockdown measures, restricted movement in areas across the country, and maintained strict health and safety social distancing, outlined by the WHO.
I was able to put on place an efficient response plan for an unknown disease, because at the beginning we didn't know anything about this disease. So I have to organize the riposte to avoid, at least to reduce the spread of the virus within our troops and the other personnel.
The mission worked exhaustively to secure the health and safety of all its serving troops and personnel.
The AMISOM police, while executing their duties in co-location with SPF, have adhered to WHO protocols at all times and have taught their counterparts, the SPF, to safeguard against COVID-19, despite the emerging new variants and waves of the pandemic.
AMISOM mitigation measures included the issue and distribution of personnel protective equipment, or PPE, to all uniformed personnel, and the establishment of quarantine and isolation facilities at sector and battalion headquarters.
We produced, with the support of our PIO colleagues, a big number of IEC materials in different languages, in English and all the language of the TCC. And those IEC material concern particularly the preventive measure and also all the mechanisms in place in case of someone is tested positive, what to do, how to refer person, all those things. The information was for the general public and also for the medical professional.
As the months rolled on, the initiation of COVID-19 screening at all ports of entry into AMISOM areas of responsibilities with temperature checks became mandatory.
I've been deployed here at the gate for screening of all people who come inside the Level 2 Field Hospital. Before these people come in, we first tell them to wash their hands with soap and water. Then these people are allowed inside. We take their temperatures, then we record them in the books. Then after there, they will proceed to Level 2 Field Hospital. We are doing all this to prevent the spread of COVID-19.
The suspension of non-essential international travel, training, and leave for AMISOM personnel and troops arguably proved the most challenging for the mission.
Although the rotation cycle of AMISOM troops and staff officers was seriously affected by flight bans and lockdowns, troop morale remained high because they were made to understand the reason for the delayed rotations by commanders at all levels through different fora.
The AMISOM civilian component coordinates the efforts of the military and police components in the implementation of the country's national security and stabilization plan, as well as uphold protection, human rights, and gender concerns in the country.
We realize as AMISOM that we have engaged new measures that have made us continue, despite in the face of COVID-19, despite the lockdowns and all those guidelines. We are able now to conduct virtual trainings which have continued, and by that we are able to continue monitoring, we are able to liaise with the local community, and when need be, we engage the local women. We pick on the key leaders in women's group who we have identified. We are able to sit with them, maybe for a short meeting, of course, bearing in mind the COVID guidelines.
The civilian unit of the peacekeeping force would prove key in taking into account lingering protection weaknesses present amongst the population and further highlighted by the pandemic.
The African Union during this time of COVID-19 came up with the policy document on addressing gender-based violence in Africa during the COVID-19. It's a very good strategic policy document that guides governments on how to address sexual and gender-based violence during COVID-19. This is because during the pandemic, there has been a noted increase on the cases of conflict-related sexual violence as well as gender-based violence. This was as a result of measures put in place to try to prevent the spread of COVID-19. In some cases, a number of survivors had to be locked with their perpetrators.
By mid-2020, COVID-19 vaccines were in development and undergoing trials as countries, including Somalia, struggled to contain the spread of the coronavirus. This equally made economic and social activities nearly impossible. WHO immunization efforts began with the development of AstraZeneca and Johnson & Johnson vaccines. Somalia started receiving vaccine shipments purchased through the WHO-backed COVAX program and the African Union in February of 2021. Bilateral donations from troop-contributing countries like Uganda, Kenya, and Burundi boosted vaccine supply, as AMISOM's designated medical planning officer, Dr. Komlan Moreira, facilitated.
We have already vaccinated more than 17,000. At the beginning, some troops received vaccine from their country. So within 2 weeks, they were able to vaccinate about 3,000 persons, and nobody has any serious effect. So I explained to them that those effects we are observing in the mission are normal for vaccination, like some body pain, headache, and it's managed within 2-3 days by painkillers.
AMISOM senior officials say viral infection rates would have likely risen significantly without timely access to the vaccine.
The Force Headquarters commends the gesture by Sector 1 to undertake the vaccination of its troops as part of the overall endeavors of AMISOM to mitigate the spread of the COVID-19 pandemic, starting with all the COVID protocols that have been in place, and finally the vaccination, which we think is going to, as the theme says, to take our lives back to normal.
The WHO's best practices principle, adopted by AMISOM for public health event management, were dependent on timeliness, consistency, technical excellence, and accountability. These SOPs did not stop despite a mass vaccination drive amongst serving troops and personnel. The principles provided clear guidance on the processes that should be followed. AMISOM leadership had to ensure this timely response through an effective coordination system that enabled the right actions to be taken at the appropriate time, before, during, and after the public health event.
The vaccine is not a cure. The vaccine is meant to increase the immunity. So that implies that we can still get problems. Therefore, SOPs, as guided by the Ministry of Health, must still be followed in order for us to be safe, to survive, and win this terrible killer.
AMISOM has managed to flatten the curve of the pandemic in the base camp, where the base camp and headquarters of the mission and the United Nations Assistance Mission in Somalia are located. Through the various stringent measures applied, the continuing dissemination of information among its staff and the exceptional cooperation of all AMISOM personnel and advocating and providing for COVID-19 vaccination among its troops in all sectors.
The African Union target is to supply 400 million vaccine doses to African countries in 2021, enough to vaccinate a third of the population. In Somalia, mitigating measures to take on frontline workers were accomplished. Thereafter, vaccination was rolled out to mission personnel, where regional uptake was less than 60%.
Fortunately, with the ongoing vaccination campaign against COVID-19, at least 70% of our officers have received their doses, and it will not deter us from achieving our mandate.
As the African Union health officials administered vaccines, they were hit with a backlash of vaccine hesitancy, growing more prevalent among the masses. Skepticism and mistrust of vaccine safety and efficacy added doubt to the ongoing vaccine campaign. These trends in public sentiments will be tracked around the globe to identify changing perceptions, behaviors, and concerns towards the pandemic. AMISOM developed messaging to dispel unfounded myths and worries surrounding immunization, with public service announcements and first-hand testimonials from its health officials, restoring optimism and increasing vaccination numbers in the mission.
A big number of our contingent, that's Sector 1, has been vaccinated. We are remaining with very few who will all be vaccinated. And all we hope that would be a tool to contain the infection within our troops.
Many of the troops in all 6 sectors, however, continue to remain compliant.
The vaccine, I believe, it protects you against the what? The coronavirus.
Now that I've taken the COVID vaccine, I'm so grateful to the AMISOM leadership and leadership of our country, Uganda, for having provided us this.
AMISOM extended doses of the Oxford AstraZeneca vaccine to local populations operating at the Halani base camp, following the reopening of the marine market after an extensive lockdown.
maanta waxaan soo taagay tallaalka COVID-19 tafeeskiisa koowaad waxaan ka mid ahay dadkii ka faa'iideystay dadkuna wilaal way hooshii way socotaa way ka faa'iideysanayaan marka waa ka hortag fiican oo dadaalkeeda aad u muuqdo sidaas la ajligeed qoqoladiina soo kaarsiisay iyo dadkiina soo kaarsiiyay way ku maasan yihiin annaguna waxaan jecelnahay inaan ka wada faa'iideysano insha Allah.
talaalka waa ku faraxsanahay waana u sheegi doonaa wixii iga dambeeya iyo wixii waanadayda qaadaan idinka iyo inta keentana aad ay u mahadsan yihiin maadaama uu cudurkan cudur jira yahay oon la dafiri karin annaguna dad iska shaqaalo yacni ka shaqeeya aan xirooyin dawlad ku dhex jira aan nahay sida badan oo caafimaadku uu muhiim yahay muhiimadda koowaad ay caafimaadka tahay in laga taxadiro annaka dhan aan ka wada taxadiro dadka iga dambeeyana insha Allah waa u sheegi doonaa wixii ehelkayga wixii war iga maqlay wixii asxaabtayda kulli waa gaarsiin doonaa idinkana waa ku mahadsantiin iyo intii noo keentay aad aan idin soo dhaweeyaa talaalkuna wax jara waayo waan ku mahadsanyahay saasaan rajeeyaa insha Allah dadku dad is dhaxgal soo biyo in wax badan noo furfurmi doonaan rajeeyaa hadii talaalka la wada qaato bulshada is dhaxgasho insha Allah.
Similar vaccine drives and medical support were witnessed across the designated sectors. Officers from the Burundi National Defense Forces, or BNDF, handed over cartons of medical supplies to Hirshabella authorities to benefit the local communities who were unable to access AMISOM bases for medical assistance under strict lockdown measures.
As you know, the whole world is facing a big pandemic of coronavirus called the COVID-19, and we decided to give some drugs to the local population just to support the health system of Shabaab state to treat local population, Somalis, our brothers and sisters.
Koronihii ayaa xayiraad keenay in meeshii ay tagaan saf galaan la baaro oo la isugu yimaado sidaas daraaddeed annagana cabashadaas ayaan u gudbinaa daawadii maadaama shalaba ay sii jirteen haddana aan la isu imaan karin inaan annaga aan gaarsiino daawada waa naga aqbaleen sidaas ayaan ugu soo wareejiyeen annagana aan tuulooyinkaas sidii maaragtay awalba ay u daaweynayeen ayaga aan u helno dhaqaatiir oo MCH camal u fadhiisto ay saas ugu yimaadaan daawadin lagu gaarsiiyo.
In Kismayo, AMISOM supported displaced families affected by the pandemic with vital relief items.
Bisyadu ma haysan sidii koronaha noogu dhacay wax caawimaad oo calaashan hadda ku saabsan waxa qalabka lagu wareejiyo bacayaasha ah iyo shandarawadaha raashinka ilaahay ku roonyahay bistooda aad baan ugu mahadcelinaynaa AMISOM tinasiisa.
The World Health Organization, WHO, is also working closely with the federal government of Somalia and a team of partners to help mitigate the contagion. It's helped facilitate testing centers across the country.
If everyone is vaccinated, or the maximum of persons get vaccinated, and we continue to observe the measure on place, slowly life will go back to normal.
AMISOM continually monitors COVID-19 trends among the mission landscape as scientists and health officials aim to deepen their understanding of the pandemic as it evolves. So as a mission, what have we learned? AMISOM troops and serving personnel will need to adhere to continued safe distancing while serving populations in Somalia. Masks work in the absence of other SOPs, while engaging communities in the work AMISOM does across the areas of operation. Hand washing is key in killing COVID-19. Vaccines help save lives. AMISOM's overall response to the COVID-19 pandemic opened the space to lessons learned in the increased need for logistical support and the creative management of peace support operations, or PSOs, in a pandemic and other emergencies. The mission has managed to continue to discharge its mandated tasks in Somalia despite the unprecedented challenges caused by the pandemic.